restart up a bit because we don't have very much more to cover. I put in your Dropbox with a New England Journal article a copy of the evaluation tool that helps you to know what we're critiquing when you present your article. And this is just a snapshot of a little bit of the information. I wouldn't say that I would like you to use that tool exclusively. I think the thing is that you still need to create a summary. You can see I wrote out a summary and I was looking at it in terms of, I read this and I wrote some notes on it, and then I went through and where there's some points here that I thought were helpful that I would then try to insert into my my critique. So that should be there in your in the Dropbox. This is a brief interlude. These are the two dogs that keep us amused at home. And I wanted to talk about protocol development, because you all need to prepare. Once you have an idea, you've researched it, you need to then write out a 2-page protocol. Have any of you ever written a protocol in terms of outlining what a project would be? Hands up. Many of you, okay. And it just helps, and I say research question, but it really should be scholarly question, because it could be quality improvement, it could be qualitative, meaning that it's not quantitative, just a little fuzzier, but still asking important questions. And then you need to think about the design, but it also has to be ethical and feasible. Has anyone ever seen Finer before? So you know PICO? So when you're looking for a project, it needs to be feasible. So you know that Kelly Russell is a dream crusher. Is it interesting? So you have to have a modicum of interest in terms of it. Is it new? And that's where doing the literature search actually gives you a little bit of an idea in terms of saying, well, everybody studied this. Is there any relevance as to why you might study it again? And sometimes it's important just to look at the Winnipeg or the Manitoba context, and that's okay. And it has to be ethical, and also you hope that there'd be some relevance to it, so that it actually, does it change your practice, or will it influence your practice in some way? So those are the kinds of things that you need to think about: the question, the population. So it's very similar to like PICO in terms of what the intervention, your time frame. So some people call it PICO with a T. So it's the population, intervention, control, comparison, outcome, and time frame. So why is it important to put together a 2-page proposal for your mandatory scholarly project? Any ideas?
So an outline to make sure that you're thinking through exactly what is going to be done.
Okay.
And helps you convince people if you need funding or something that's laid out.
Okay. So you've got a plan. Anything else down the road when you take your final project and then you have to prepare a written document? Will your protocol or proposal help you in any way?
Because part of it will be literature review.
That's right. So you have a big section of background. Once you've collected your data, what is in your proposal that helps you then? I've got all this data.
Discussion.
So before you get to the discussion, you're right.
What are you going to do?
What analysis are you going to do? So you actually have to line everything out. So the thing is, once you've got it, as Karen said, everything all sort of lined out, you know exactly where I'm going to get the information. Is it ethical to do that? What am I going to do with the information when I have it? And I've already got this great background information. I've already reviewed the literature. I may need to refresh my literature, but then it makes it so much easier, as you said, to create that discussion, right?
I think it also allows for you to ensure that what you're planning is not just doable, but that the team and the department's on board. Like, I know it's not a thesis, but I've watched tons of people go through academic programs and they get to their final thesis and they're told that what they were doing was never going to be. Whereas I had a thorough proposal been done, they would have had half their thesis presentation finished and they would be still working on a master's in everything.
So it's a and what Karen had also said about funding, that I'll talk a little bit, maybe not a little bit now, and I'll mention again that the CRAM, so the Children's Research Institute, whatever it is, of whatever it is in Manitoba, has small grants of $2,500 and is offered twice a year. So it's $5,000 for staff and $2,500 for residents. So if there would be some small funding that you might need, either in terms of, for you, Duncan, in terms of getting consent for someone who's going to the concussion center, or that you were offering them that they came in and participated, did the survey, and you want to give them a small gift for thanking them. So again, it's not coercion or bribery, it's a small thank you at the end of it that you want to have a small pot of money for doing that. You can do that. If you have some problems and you get 5 free hours of statistical advice from CHI, but most people go to a toll in terms of asking for advice. He doesn't get paid for that, but if it's really quite detailed analysis that he may need help with, then he'll say, well, this is my budget. He's $150 an hour, or $450 if you're pharma. So don't be pharma.
If you're a farmer?
Pharma.
Oh, sorry.
Pharmaceuticals.
It's like, why do farmers have to pay?
No, pharma.
And what are they doing?
Pharmaceutical, $450 an hour.
Sorry.
No. Okay. So, and you need it for the RAB application, and also if you're going to put in an application for asking for money for CRIM, you need, actually they only want a page. Okay. So what are elements of a proposal? Because I know Kelly already asked you earlier today what some of the things are. What do you put in it?
Who's involved?
Title? Sorry, what's next?
Who's involved?
Who's involved? So who's your team? Yeah. What else? All the standard stuff that goes into a manuscript, actually.
Introduction.
Sorry, an introduction. I really am plugged ears. Or background, as Sabine had said. Yep. Your question, and often with your question, you're not only going to have just a hypothesis, but actually a specific objective, right? I hypothesize that it's sunnier here in Manitoba than it is in Montreal. That is actually correct. We have more sunny days here than whatever. But my objective is then to actually go and find out whether or not that's true. I hypothesized. Okay, what else? Those are your objectives. And then you get to that part that we all really hate, the method section, in terms of, and again, you can tell with the New England Journal article, it talked a little bit about, I don't know what my hypothesis was, and then I'm going to say, how did I get the data? What are my outcome variables? In terms of, I wanted to know what the BMI is, so I needed height and weight to do that, and then I needed to get any covariates in terms of their sex and their family ethnicity and background, their socioeconomic status. And then I have to outline then how I'm going to analyze it too. Ethics?
I'd say too, for the, on the methods front, often your proposal is more in depth than what anything you'll later will write, like Tyler supervision. We'll spend tons of time, but no one wants to read about it later.
Yeah, but the thing is that when you've collected the data, then you go and you say, I know exactly what I'm going to do. Now, sometimes the data doesn't actually work out, or you get fewer patients than you expect, and sometimes you may have to modify it, but at least you've thought about it. And one of the things you're going to notice, and we're going to talk about next week, Monday, I think, is sample size. So that's a really good stats. Because we talked a little bit about it. Why do I even care about sample size? So if I have a negative study, okay, so say that the residents did not prefer M&Ms over Smarties in the Ask curriculum, maybe I wasn't powered sufficiently to actually find that out, right? So I could say, no, there was no difference. They like M&Ms as much as they like Smarties. That was Maria Elena's question. She prefers M&Ms over Smarties, if you want to know. Okay, so, but the thing is that the negative answer could just mean that I didn't ask enough residents to do it, right? You need timeline, you need references. So I already mentioned to you that whenever you do develop your project and your idea, it's important for it's not going to be your lifetime's work. You're just doing a project. So I think the thing is that the literature search when you have your idea, so I know, like Duncan, we were talking a little bit about marijuana and concussion, and you might go and you might say, well, gee, there are 3,000 studies on it. Do you think it's reasonable for me to do 3,001? And you may say, well, maybe if there's a specific question that I can ask, that I think that that's tailor-made, then it's answerable, it's novel, and it's worthy of either publication or undertaking it. And that's what you're also going to see at the WIPs today at lunchtime, is that sometimes the question isn't always really carefully thought out. Okay. And then these other things that we put in the inclusion-exclusion criteria. So if you want to do a concussion study with marijuana, you may say, do I want 3-year-olds? Only if their parents have had the marijuana intake in terms of the concussion. So you may say, I want only teenagers from the ages of 12 to this age and up to 18. And I want to be able to make this feasible. I've done my sample size calculation, so I know I can collect these data in 3 months, so I'm good. But it's going to take you 30 years to get a sample size. Is that a good study to do? No. So that's part of all this preliminary work. And then they said whether or not it's going to be a survey, you're going to do an RCT, and I actually think that most residents don't do RCTs. I think, Robin, with the exception of doing the question of maybe a SIM or something like that, in terms of then saying that some people are getting the SIM and don't, and you're looking at their knowledge pre or post. But for the most part, we're not going to be saying, here's IVIG, and let's see if we can treat this disease and follow up for 10 years. Okay, that's not a good project. You're going to meet with Janine next week, and she's going to talk a little bit about what the CRU, I hate acronyms, stands for the Clinical Research Unit at CRIM, and that she's actually very helpful in terms of I will put together something and I say, who do I need to submit this to, or what are some of the timelines, and can you help me with that? And we talked a little bit about the team. What's KT? Anybody know what KT is? So what does that mean, Robin? So did everybody hear? I don't think I've even heard. Over the jackhammer, sorry. Knowledge translation. So we do a study, and we're looking at the impact of marijuana on concussions, and say that we found that lots of kids from the ages of 15 to 18 had marijuana in their system and had a concussion. What do we do with that? We say, isn't that interesting?
You want to be able to share your information with others.
Yeah, and then ultimately, not only sharing it, but you want something done about it, right? So who might you go after in terms of, so who's selling the marijuana, right?
Soon to be the government.
Soon to be the government. So we're going to say, just like, they do your ID check at the liquor store, right? You might say they have to be over 15 or something like that in terms of they can't have access. But we all know that you just pay somebody to go get the marijuana anyway, just like you do with the alcohol. Oops, I didn't say that. Right? But we know that kids will be kids in terms of doing it. So the thing is that knowledge translation piece, and the thing is that do you want to put it in at the end when you've got your results, or how would you like to integrate that KT? And you're going to have a KT session probably next week. How do you want to involve these knowledge translation people, right? So yes, you can put out a poster, and but who do you actually ultimately want to go to? We're not talking Terry Klassen, above Terry. Regional Health Authority, the government.
Like the study we saw the other day that wasn't perfect, but they did incorporate people through the whole study who are on the ground with Google and implement and make changes. So by doing this, they automatically build a knowledge translation in.
Yep. So I just put in the grant, and I was funded, and it was looking at the outcome of the insulin pump programs in Manitoba using administrative data, comparing it to Quebec. So we're doing a partner in Quebec, Manitoba project through MCHP, and I already got the government people on board. And the government people said, yes, we're spending millions of dollars every year for putting pumps and pump supplies for kids from the ages of whatever all the way up to 18. And they actually want to evaluate, does this program make a difference? Quite frankly, I think that it's horrible what we get in terms of A1C compliance, and I think that I'm not actually really pleased with our outcomes, but the thing is that's what I have to actually do. But they came right on board. I said, I'm thinking of doing this project and getting funding to do it because the government doesn't necessarily have money to look at it. They put the money, the millions of dollars in terms of saying, yes, we'd like to do it because everybody else is giving kids with type 1 diabetes, they're giving them the pump. But I said, well, we should actually look. Is it actually making a difference? Is their A1C better? What other outcomes do you think might be important for the fiscal pocketbook of the government? So the A1C is good in terms of long-term complications, which is also fiscally good because of the renal failure, the eye blindness, and everything else. For
hypoglycemia, ER visits.
Absolutely, all those things. So we put those outcomes in, and they said, yes, this is really important. And they said that, thank you for assessing this. So we got money to do that analysis. It's already been done in Ontario because they've had their project longer, but they didn't look at A1C, and we're doing a cross-province difference. And in Manitoba, we don't pay the whole cost of all of the supplies, where in Quebec, they pay for all of the cost of the supplies. Do you think that might have an impact? Like you say, why do you have two provinces? In Quebec, they pay for all of the supplies.
Like the patient pays for all of it?
No, the government pays for all.
So in theory, there's a better chance chance of people sticking to using.
So that they get all their insulin strips, the catheters that cost $4,000 a year, whereas here we say once you meet the pharmacare deductible, which could be $6,000 or $10,000, then the government will pay for the rest of it. Do you think that biases who goes in and uses the pump in terms of socioeconomic status? In Quebec, you think you probably could have anybody of any socioeconomic status if it was fully paid for, right? Versus here, you have to be wealthy enough to be able to say, well, I can pay that $6,000 or $3,000 difference, and I'm going to put it towards my child
How does
diabetes
that
care.
change? This maybe is not right now, but how does that change if you're First Nation and you're on the federal health? Like it's a different health plan altogether.
Yeah, they have a different healthcare altogether. And we don't have anybody whose First Nation status is on the pump.
So theoretically, the results here will be better than Quebec.
No, I think they're going to be better in
Maybe the other way
Quebec.
around.
I think they're better in Quebec because, in fact, all the supplies are paid for. We know that people that can't even get their insulin strips, they have terrible A1Cs because you can't adjust your insulin if you're not testing.
Yeah, but he's saying here the high socioeconomic will be using.
Those are the only people though, so there's everyone else who doesn't have a lot of money
Right.
who's not using it.
But you're right, but then it's still what the outcome in terms of the number of hospitalization, does it vary by socioeconomic status as well, too? We know in Quebec that the rates of DKA don't vary by socioeconomic status, whereas here they do vary by socioeconomic status here. So whether or not you can't afford the strips here, but you're right. So I'm just going through all of the ethics and things, so I don't have the project yet, but I got government on board, both sets of governments on board, and that's part of the reason that CHR said, well, we'll fund you, Celia, because you actually have a direct line to the government to say that we want to use this information. They both wanted to evaluate it, okay? So it was a high level in terms of going then to do that.
That's a very front heavy too. A lot of people would do the front heavy, it would be an afterthought.
I know, but it is important that you kind of say, well, what do we do with this project? And you think, well, I'm just doing a little scholarly project, but your projects have an impact. Like with Maria Elena, she and I have done a case series in looking at the number of cases of rickets. Well, when we talked about the number of cases of rickets in Manitoba, which are quite high, vitamin D deficiency, we actually got comments back from the regional health authorities saying, we want to know what your data is. Because I made some presentations saying that we're collecting these data, and they said, we want to know, because they want to know how they can reduce the rates of it in terms of the number of kids who come in with hypocalcemic seizures. Because it's the bottom dollar. Can you actually make sure that the vitamin D status is better so you don't have either the bowed legs or the seasoned little baby that comes in? Okay. Revisions of protocols. So we create them, and then we have something called a WIP. Why? And you're going to have a WIP this afternoon. So why do you think we have WIPs called Works in Progress? It's not sadomasochism. There's no H in there, okay?
Because more expensive eyes always come up or see problems in the mind of this.
Exactly, and defining down and distilling your question to make it very manageable. And it also gives you a sense of time, too, to reflect back on your question, because it's actually, you just need to keep refining and be open to feedback, and we all love being open to feedback anyway. So we just want to make sure you have enough time. And part of the reason for implementing the ASK curriculum in the autumn or early in your R1 is to give you enough idea, because that by the start of your second year, you should actually have a project identified, and by September of your second year, actually have a 2-page protocol that you said to me to send out to the committee to have a look at it. No pressure. In Halifax, they have, when they do this course in January, they send out usually about 2/3 of the people by the end of their ASK equivalent curriculum have an idea and already have a preceptor in mind. Okay? So it actually helps. You don't have to write this all on your own. You have a supervisor who helps, okay? And then we'll talk about the ethics. So now we're going to switch gears and talking about supervisors. So you have mentors who are often for career guidance, but I specifically call it a supervisor. Supervising and mentor may be the same. So what kind of things are you looking for? Is there anything else you want to know about the proposal? Because you actually know what goes into a protocol. It's very similar to what's in the manuscript. So what kind of things are you looking for in a person who is going to be your supervisor?
Has a good experience in this area.
Yes, so somebody who's experienced, that always helps, okay? And if somebody doesn't have experience, so say there's a new faculty who's relatively new, but they seem right up your alley, what can you do if that person has a great idea but doesn't necessarily have that experience?
You get a second supervisor.
Absolutely. So you can have, like Minka Cheng calls it, a board of directors, okay? And then your RSAC is also your kind of your board of directors too, to help out in terms of making sure that question is good. What else?
We have to share the same interest.
The interest? Yeah, good. Yeah, Robin?
I think what Diana had talked about when she was here is there has to be some level of compatibility, which isn't necessarily going to be the same for every person, but sometimes that's having similar working styles, and sometimes that's having somebody who's very different from you who challenges you. Yeah, exactly.
Or not always,
Yeah.
okay? But yeah. What else? Do you want them to take 3 months to send you back an email?
No, they have to have time.
They have to have time, they have to be
Your
accessible.
expectations.
Absolutely, define up the expectations right up front in terms of saying that I have this idea, I think that, could we work together on this project? What do you think? Would this time work well in your life? No, I'm 17 months pregnant and I'm going to explode tomorrow, and no, this is the wrong time for doing it. We have a number of residents who kind of show up and they knock on the door and they say, hey, I'm here for my research elective block, and we look at them and we say, sorry, did you arrange that with me already? So you also have to line this up. And I will meet typically with you in December or January of this year to say, do you want to put in for a 2 to 4 week elective block that you have to decide in January for your R2 year in terms of doing that? And that it used to be that you would get 1 4-week elective in your second year, and it could either be an outside elective, and many people were looking at subspecialty and wanting to go away for that, or it could be then a 4-week research block, but they finally relaxed it, so you can have a 2-week research or scholarly block and then a 4-week elective outside, so that you still can do an outside rotation, which I think is really important for people who are interested in doing that, but you can still then have a sampling of time in terms of either working on your proposal or whatever you want to work on, okay? So I will contact you and bug you a little bit in terms of saying, do you want this or not? But just for time planning, it's nice to know if you're that far along, you say, yes, I've got a project already identified and a person, and I think that 2 weeks would be great to consolidate and write this up and get going. Okay. So, we talked a little bit about their available, that they can support you, compatibility, and also the skills to actually help out, and a track record is helpful. But it's important to know it doesn't actually have to be somebody in the Department of Pediatrics. So there's some people that come here, like Kelly Russell is in the Department of Pediatrics. She's a PhD scientist, so she's not an MD clinician scientist. She's a PhD. And then we have some people like Martha, we've got somebody from the Faculty of Education who's helping with this evaluation here. It's very helpful to go to somebody who had expertise in course evaluation and went to somebody who said, they do this all the time. I said, that's great, we'll plug in to do that. So he's on Martha's board of directors. So what kind of skills do you think your supervisor might have? So one is, what kind of skills would be important? So we talked a little bit about attributes. How about statistical, if you're looking for a quantitative study? Would that be helpful?
Yes.
Yep, that would actually be helpful, that they're an expert in the domain that you want to go to, and you may have several people that help that's going to do that. The other thing is money, or access to money, because if you need to create something small, now I'm not talking about a $40,000 grant, we're talking about something that's at $2,500, maybe $5,000, something relatively quite small, but it's nice to have a little bit of money for either photocopying or getting a research associate to come in and ask you all to consent, thank you very much to the project, but I have to pay you, isn't it goodwill for doing that? So funding is nice. And then getting something mentioned a timeline in terms of the expectations. And I haven't sent you the timeline yet for the, I just mentioned a couple of dates. So one of them is deciding December, January if you want an elective. And I said, and then in really September of your second year in terms of a 2-page proposal. And so this is what I'm doing. I'm tracking down all the second year residents right now and sort of saying where are they at with their proposal.
I assume this is true in our program as well, but with expectations, it's not just also like the timeline piece or that you'll finish your project, but also like the size of the project and will it be presented somewhere and will you publish it? Like I worked with someone who, if you didn't publish your work within a year, he would publish it. Like that was a thing, and he was upfront about it, and like that was fine. I didn't work with him, but you know what I mean? Like being very, like all that stuff, or authorship. Will you have authorship, or will it be a co, or who gets first, or like all that stuff that you feel like normal people can just figure out, like adults, but really upfront having a conversation about it.
Yep. And so So in fact, in terms of authorship, it's different in the different domains that you are working in. Robert Renaud, the education person, said, oh, don't worry about me. He said, I'll just be the last author. But in education, that was the least significant role by being the last author. But in medical, it's either the senior or the first author who are the most important ones in terms of saying you design the study, and there's different weights. Some people like being the first one, even though the most senior one, because when you have 17,000 people as authors, it gets truncated down to blah, 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 at all. And they want to be one of the blah, blahs at the front, so that sometimes people are going to fight for being the blah, blahs at the front, okay? Most of the time, the residents, and I think that's a very good point, most of the time I say that because you're doing most of the work, that you're going to be the first author, and then whoever is your supervisor is going to be the last author on it, but you have a board of directors who are in the middle who may help with it too. It's important too to be upfront that sometimes there have been people that have said that if you don't put my name on this, then I'm not allowing you to publish it. And in fact, there was a case in Halifax of a cardiologist who was a new career person, and somebody was very jealous of her grant money and forbade her to have to do clinical work, forbade her to publish any of her literature.
Not a small amount of money in the end, but.
Yeah, it was about $4 million, I think, was her settlement. But this was
It completely impacted her whole career.
absolutely, it was 10 years that she didn't work as a cardiologist because of this. It was dreadful. I mean, that this person was just jealous of her and did that. We're not the same kind of level of stakes that we're talking about here in terms of doing it, but it's important to kind of say, so, and the thing is you're not writing a contract, although you can create a contract either through an email, so if we do this project, then I will be first author, and yes, we want all of you to present. There's Child Research Day, and so we've asked all of the residents in the 3rd and the 4th years if they want to do a poster to do that. There is money to be, CRIM has big pockets, and they want to make people put out their scholarly project, and so that they actually have money for residents who put up their posters and do that kind of stuff. I think it's like $500. So they have gold, silver, and bronze levels, and unfortunately, most of the time, up till now, there have been, even I think this year too, there are not very many residents who actually present their posters. So I'm hopeful that Rosanna, who worked on a project with me, gets a gold level prize for her work, because I think she's the only R3 that's actually presenting a poster, which is really sad, but I'm working to improve on that. Let's be positive, okay? So yes,
There's a reason to do a protocol, because that's half your poster.
it is.
I think like another thing to realize, like to be aware of when you're going through a project is whether it's like a discrete on its own thing or if it's part of a bigger picture. 'Cause for my BSc Med, I knew this going in, so this wasn't like, this isn't a bad experience, but like in terms of core basic science research on brain tumors, my BSc Med was like nothing, but it was part of a bigger picture. So when I presented it for my BSc Med, it was fine, but it wasn't enough to make a paper out of. The data ended up on a paper, and I still got like a 3rd author paper out of it, but it wasn't substantial enough to stand on its own. And if your goal is to get a first author paper, you don't want to end up with a project that's part of a bigger picture that's not going to get published till you're already staff.
And we're talking like money, publishing, and going to conferences also costs money, and often people don't even know that, and they're talking about funding.
Oh, so I was going to bring that up, thank you. So the thing is that if you're actually presenting, your way is entirely paid.
In this department always.
Sorry?
In this department always.
Yes. Oh, yes. So you get an allocation for money for going to a conference, but if you actually present, like Maria Lenowin presented an international pediatric conference, and so I was in Washington, 10 days ago, and I said, do you want me to pay for any part of this? She said, no, it's all covered. Even though she went to another conference, I said, it's all covered, it's all covered, it's all covered. So,
Which is huge.
it is huge. No, because again, I think that there's a lot of push here for people to actually get the knowledge out there to do the project, but also that the reward of either doing an oral or a poster presentation in terms of doing it. It's fun to do that and to meet people. It's a little intimidating at times, but you just get to meet other people in terms of doing it. So it is mandatory. You do actually need to actually also write up a manuscript at the end of your project, okay? Otherwise, there are consequences that you can't actually leave the pediatrics program. I don't do that part of the consequencing, but it's there. But we're there to support you, and then if you want to finish it all by the end of your 3rd year, then that's fine in terms of getting it out of the way. As soon as you get it done, you're fine, and you're done, and you hand it in. And they said, we want you to present, and I said, you can present it locally, and then your supervisor often really knows where to present it elsewhere. So, and there are funds to pay for that. So those are good points. So setting up a timeline, and also, as I said, you have to arrange so early in each year, like in December, January of each year for the next year, in terms of actually trying to get a block for your elective time too. So just to be upfront about that. Okay. So you also have support, as I said, this resident, actually it's called RSAC. It's actually Resident Scholarly Activity Committee or whatever it is, or academic committee. So we actually help too. So your 2-page protocol actually comes to us and then we look at it and then we speak to you and your supervisor and make sure that it's really worthwhile because we don't want you spending 6 months doing something and it not being at all a reasonable project for you. And the thing is, as soon as you have an idea and you want to have a supervisor and you really want to do that, you can send it in sooner to me than before that. It's whenever you want to send it in, we're happy to have a look at it. And we're there in terms of just guiding you so that it's successful at all levels, okay? And I go back to the research guide, which unfortunately I can't download for you, but you can just go to the library and actually borrow it. And I have no idea why I put the practical epidemiology primer. Sorry. So were there other questions about your supervisor, your proposal, journal club, anything else this morning?
You mentioned briefly that there will be like a timeline thing that we'll get at some point.
Yep. I can send it out to you ASAP if you like. Okay. I'll actually put it in the Dropbox. I was making
Now
notes
that we
myself.
started talking about.
Yeah, no, that's fine. I'll do that. I'll send out the RSAC timeline. Sorry, I started a note to myself. The primer to, before I forget, the primer to the statistical is now locked. I sent you an email.
Yeah.
So you have the passwords. It's highly original. Was there anything? I wasn't sure how long this was going to take this morning. So we have a whip, and so we'll leave it about 11:45 to get over to the whip, which is, do you know where the room is? CH 181, 183. We're going to be moving the whips over to your academic half-day room by the PICU later in 2018, so that people who are off-site can also join in, and it's much nicer than CH 181, 183.
The department, the ethics of a journal club separate from the